Hi everyone, thanks for joining us with Hope with Answers. My name is Dr. Sydney Barnett. I am a lung cancer patient advocate and I am living with stage 4 ALK positive lung cancer. I am joined here with Dr. Kaufman from the Ohio State University. You want to introduce yourself?
Hi, I'm Jacob Kaufman. I'm an assistant professor at the James Comprehensive Cancer Center at Ohio State.
All right, so I'm here to ask you some questions about liquid biopsies. I know a lot of us have heard about it, but what really is the difference between a liquid biopsy and a regular tissue biopsy?
That's a great question, Sydney. Let me start by talking about kind of what's involved in a regular biopsy and the type of information that we get from that, and then we'll contrast that with the differences of a liquid biopsy.
Okay.
So a tissue biopsy is when a needle goes into an area, and when we're talking about lung cancer, goes into an area of the cancer and pulls out cells from the cancer and then puts them on a glass slide. Pathology doctors, those are the doctors who specialize at looking at cells under the microscope, can look at the appearance of the cells, tell certain features about the behavior of the cancers, and can also do specialized stains that, for instance, can help determine whether the tissue was taken from a cancer that started in the lungs or a cancer that started in some other part of the body, like the colon or the breast.
Right.
So there's specialized stains and tests that can be done on the microscope slides. But in lung cancer in 2022, we try to learn as much as we can about each individual patient's cancer so that we can link them with the best possible treatment for their cancer. So in your case, your cancer was found to have a mutation in the gene ALK, and your treatment is consisted with oral drugs that target the ALK mutation.
Right.
So in order to get that type of information, that can't be determined just by looking on the glass slides.
Okay.
You do additional testing to sequence the DNA of the cancer, looking for mutations in ALK and EGFR and dozens or hundreds of other genes that help inform the way we treat lung cancer.
Right.
So that is information that can be done from the tissue biopsy. Liquid biopsies are different because they actually look for that mutation information from DNA that started in the cancer but went into the bloodstream, and it's a blood-based test that does sequencing of DNA circulating around in the blood that can tell us information about the mutations in the cancer.
Okay. So when would we use the tissue versus the liquid biopsy?
So the tissue biopsy is absolutely essential for making that first diagnosis of cancer, proving where the cancer started in the body and giving us a lot of essential information. And the molecular testing on the mutation testing on the tissue biopsy may give us all the information that we need. But in some cases, for instance, it might be a very small amount of tissue that comes out of that biopsy, and we might need to supplement it by doing the mutation testing on the blood. And there's some other clinical indications for using a blood-based or liquid biopsy in other situations in care of lung cancer patients.
Well, this has been just such a helpful conversation. I want to thank you for just keeping me a little bit more informed about what is going on in the lung cancer sphere.
Well, thank you. I appreciate your questions and having me here.